Hello, everyone. Welcome to Faculty Spotlights for the College of Professional Psychology at the Chicago School. We're very happy to be joined today by Dr. Jill Johannson-Love, Department Chair of our Clinical Psychology program in Dallas. Welcome, Dr. Johannson-Love.
Thank you. Thank you. Very happy to join you today.
Fantastic. Well, Dr. Johannson-Love, why don't you just start by telling us a little bit about what inspired you to pursue a career in psychology?
So I have personally always been curious as to why people do horrible things to each other. And that was kind of what inspired me from an early age. I read true crime and unsolved mysteries. And I just couldn't understand how a human being would do these things to another. So that kind of drove me into clinical psychology, just understanding how that happens, as well as being able to, through that understanding, actually do something about changing it and hopefully lessen crime.
Yeah. So I guess on that, a lot of your clinical work has been focused in the forensic realm, correct?
Yes. 95% of it is in the forensic realm. So I'm biased. So my bias is that you should have a clinical psychology degree as a basis before you go into forensic psychology, because you're going to see everything.
Sure.
You see every single clinical issue there is, and you see all ages and all kinds of problems. So I
So
value
now,
that.
now that you're leading the program, the clinical psychology program there in Dallas, maybe tell us a little bit about what you enjoy most when it comes to teaching and working with students.
So for Dallas specifically, what I really enjoy is the fact that it is what I call the baby program of the university, and
Hmm.
that we're constantly kind of reevaluating and checking in with students and trying to figure out what works and how we can improve. And I think we have a tremendous, just this school in general, a
Hmm.
tremendous support for our students that I never experienced when I went through school. And I think that is something that is really good for all of our students, because they come from different backgrounds, different ages, different experiences in life when they come in here. And I feel like we do a good job trying to juggle all their needs.
Yeah, and the Dallas program there is the newest of our PsyD clinical psychology programs at the university, right?
Yes.
Yeah. What's one skill or lesson that you hope all students take away from their time in the program there?
That you're never done, that you should be a lifelong learner, and to utilize their critical thinking skills.
Yeah.
That's kind of my hallmark. Think for yourself, get the evidence, evaluate the evidence, always keep questioning and keep learning.
Yeah, it's an important kind of life orientation for everyone, but it's particularly important if you want to be a clinical psychologist at some point in
Yes,
your life, right?
most definitely. You can't just say, "Oh, I got my degree and I'm done and I'm not going to keep up with anything." We have to always keep up with the newest in order to be
Yeah.
able to be effective with our clients.
Yeah, got to be a lifelong learner.
Yep.
So, if you were going to give some advice to students entering the field of psychology, what would that be?
Develop very good self-care skills so
Hmm.
that you can manage your own emotions and stressors early on. And if you don't feel like you have them, get going on developing them and try different things, see what works for you, and then also work on time management skills, because that's
Yeah,
something that you're going to need when you go into the field, as well as organizational skills. So if that doesn't come naturally to you, then start working on trying to figure out what works best for you.
absolutely. Yeah, I think that self-care piece is critically important. I think as students enter doctoral programs, particularly in clinical psychology, and move into working as a licensed psychologist at some point, one of the things that they underestimate is the workload, is the rigor, and some of the just kind of personal challenges that arise from that, right? A lot comes out about yourself as you work with other people, and you're tasked with just managing a lot as you move through a program and even after the program and move into the field. So understanding that the value and the critical importance of self-care and asking for help when you need it are absolutely critical.
Yeah, and also having the self insight and the self reflection. Our students do a lot of reflection in their courses in the first year, and just being able to catch yourself when maybe you're not doing too well and that you need extra support, or you need to talk to somebody, or you need to up your self care because you're not going to be effective with your clients or with the work you're doing.
Absolutely. So I'll close with a final question for you. Why, and I think you touched on this a little bit earlier, but why do you think students should choose the Chicago School to pursue their doctoral degree in clinical psychology?
So I think our university as a whole offers a wide variety of programs that will in psychology that kind of can hit whatever interest area that a student might have. We also have a lot of supports throughout the university to actually help students along. I know this is a PsyD program, so a lot of students are really scared over the whole dissertation piece, but I know
Mhm.
that we have a lot of resources for them through the library and through the writing center and just nationally that like I said, I didn't have any of that. I had to photocopy things, and now you can have a citation manager that just
Mhm.
keeps track of everything. And we encourage all of our students here in our program to kind of start focusing in on the things they're interested in, start collecting articles early on. So get that citation manager up and running even your first year, even before you start honing it into your dissertation work. So you start collecting the research. But in addition to that, I think with the one university model, just being able to collaborate from my standpoint with other chairs and learn from each other and figure out how best to help students. If I'm new, this is the baby program. This is the first time we're experiencing something on our campus. We
Mhm.
can be certain that it has happened on a different campus, and I can get some input on how to address it and better help our students.
So just lots of personalized support.
Yes, for sure.
And I think we'd be remiss if we didn't put in just one more plug for the PsyD program there in Dallas, is the beautiful new campus that you just moved into.
Oh, most definitely. It's really pretty, or posh, as my students call it. And they're very excited since there are a lot of lunch options around here too. But it's very pretty, and students have a lot of smaller rooms and hangout spaces. And I think it's really great for them to be able to sign out kind of a smaller conference room to do their
Yeah.
assignments. I just dropped off my child to have an IQ test with one of our first year students, and they have signed out the conference room and they're ready to go. So we definitely have facility to support our students.
That's fantastic. Yeah, I know that campus was designed with students in mind, so it's a great draw. Well,
Yeah.
Dr. Johansson-Love, thank you so much for joining me today, and we'll talk again soon.
Thank you for having me.